care of veterans is as much a cost of war as the cost of wars and tanks and guns. The American people understand that. That's what they wanted, and that's eventually where the Republicans came to us with.
Well, despite the fact certain lawmakers and pundits scream about nothing getting done in Washington, which we hear pretty much all the time and every single day, as a matter of fact, Congress actually pushed full steam ahead in trying to fix the massive problem that is the Veterans Administration. A $16 billion measure passed Thursday night went right to the president's desk for signature. Of course, with a whole lot of questions. How confident can anybody be that the steaming pile that has been the VA for so long is actually on its way to being seriously brought into line? There's a couple of things that you need to consider here, first of all. First of all, the VA reform is what they are calling it. Betsy McCaughey wrote this week, and actually it is still today, on the Newsmax.com website, that the VA reform bill is a sham. There's a number of things in here to consider as well. It is the Veterans Access, Choice, and Accountability Act of 2014. Supposedly, it keeps veterans in check and gives them what they want. That is supposed. It is at the mercy of the VA bureaucracy. It does not give the newly appointed VA Secretary, Robert McDonald, the firing tools to turn around the VA. This is the affordable health care. Let's take that graphic down because that's not what we're talking about right now. So let's talk about the affordable health care in just a couple of minutes. This is along the VA here. The worst of the bill's scams, according to Betsy McCaughey, is the Veterans Choice Card. Here's something else that veterans need to know. It's supposed to make it easier for veterans to use civilian doctors. It has Section 101F, and again, there's all these different ways here. Section 101F says that every vet enrolled in the VA system will be issued a card that, quote, may be presented to a health care provider to facilitate the receipt of care or service. In other words, it's supposed to make it easier for veterans to go to somebody else and get their health care. Unfortunately, it's just not that true. And we need to dig a little bit more into exactly how that's going to be true. Let's welcome now the author of that article that is on Newsmax.com. Betsy McCaughey joins us by telephone. Betsy, thanks so much for being here.
Well, thank you. I have read this bill thoroughly, and it does not offer veterans what the title of the bill suggests. It says it's called the Veterans Access, Choice, and Accountability Act. But in fact, it doesn't really give veterans choice. It only gives them a choice card, but they're not actually able to use that card. Let me walk you through the steps.
Yeah, please do. As a matter of fact, just so you know, I gave everybody a little chance here while we were, a little idea as we were getting it on and getting you here, talking a little bit about your article, VA Reform Bill, a Sham, where you talked about Section 101F. So I gave them a little idea here, but if you would, kind of fill in some of the gaps.
Well, that's right. There are so many hurdles between getting the choice card and actually having a choice to go to a civilian doctor. First, you have to get certified that you haven't been able to get a VA appointment within what the VA considers a reasonable time, or you live 40 miles or more from a VA hospital. Good luck getting that letter. I know vets who have waited months calling the VA hospital every day and not gotten a response. Then if you get the letter, they don't make an appointment for you. They put you on a waiting list. And then you have to wait for them, wait for them to make an appointment with the doctor. If you finally get that appointment with a civilian doctor, the doctor then has to call the VA hospital and get prior approval before treating you. Well, good luck getting that call answered. And then here's the most outrageous part of all. If you manage to get to a civilian doctor and get the care you need, this bill says you can only be under that doctor's care for 60 days, then back to the VA you go. So it seldom is cancer cured in 60 days or diabetes treated or heart disease treated. You finally get to a doctor who can help you, and you only have 60 days.
All right, now I'm going to ask a really simple question then, Betsy, because as someone who knows this, you've researched it, you were in government as a former lieutenant governor of New York State. How in the name of goodness sakes does something like this, and boy, I cleaned that up really good for an audience, for a family audience here, does something like this that is so flawed get passed and walk onto the president's desk?
Because members of Congress haven't read the bill. I actually went down to Washington several weeks ago and testified against the previous iteration of this bill, which is almost identical to this, and warned members of Congress on the Veterans Affairs Committee that this was a sham. It was designed to protect union jobs and union dues, but not ailing vets. And that's really the tragic story here, that the VA is run by the union and for the unions, and they don't want vets leaving the VA system to get civilian care because it will mean fewer union jobs.
Betsy, are we really just looking again at an instance where this is a quickie fix, number one? And number two, I don't do this very often, but I think we have to if we're talking about this and what you have discovered here and what you looked at in the bill. We're looking at a media, perhaps not misrepresentation in many ways, but certainly not a complete representation. I hold in my hand right now an article from the Associated Press. Senate okays $16 billion spending bill to improve VA health system. Congress has passed the bill. It's from the Associated Press. It's today. It goes in a lot of the newspapers and a lot of these different websites, and it says everything is fine and taken care of, and it makes it seem as if everything is just hunky-dory with the veterans here. Why is so much of this being missed?
How many reporters have the time to read the legislation? They didn't read it either. And the fact is, this bill is advertised as solving the problem, but it doesn't do it. I'll give you another example. We know that there's been tremendous corruption at the VA, and the vets have taken the brunt of it, all this manipulation of the waiting list. And yet, despite that fact, most employees at the VA still get hefty bonuses. So one thing that this bill does is it caps bonuses. It caps them at $360 million a year. But guess what? That's not a reduction. That's just about the same amount they get every year.
Something else that I needed to ask you about, and correct me if I'm wrong, please, on this. A vet who manages to get outside care can only stay with that doctor for 60 days. Then it's back to the Veterans Administration.
Well, that's right. And that is a clear sign that this is not a sincere effort to give sick vets the care they need. Because a vet who has cancer or heart disease or diabetes is not going to get cured in 60 days.
Weren't we told, though, by our lawmakers, by the people that we send to Congress, that this was going to be taken care of? There was shaking of heads. There was anger. There were fists being pumped. There were people saying, we are going to fix what's wrong with the VA here. Now we have this. Why then do we have this if these people said they were going to fix it? How could they be so wrong?
Shame on members of Congress who stood there patting themselves on the back for being bipartisan and enacting this bill before they flee Congress for their August vacation. That was the real motive for this. Self-congratulations. But the fact is, it doesn't help the vets, and there is a simple way, a lower cost way, but most importantly an honest way, that we could help these vets. Half of the vets, 45%, half of the vets in the waiting lines for care are seniors. They have Medicare, but they're sticking with the VA hospital because they can't afford the out-of-pocket costs. If we gave each of those older vets a Medigap card, a special VA Medigap card, we would clear half the backlog immediately, and the rest of the soldiers would be able to get, the rest of the vets would be able to get the care they need. And that would be so important for these senior vets because most of them are going to the VA hospital for age-related problems, and they actually have better survival rates at the civilian hospitals when they need things like bypass surgery or diabetes care.
With the disasters that we have heard in so many ways and with the number of veterans that I know who deal with the Veterans Administration, I don't know why you'd want to go there in the first place. Not to every hospital. It's fair to say. But let me say this. It's fair to say there are good VA hospitals out there, so we're not going to hammer them all, but there's still a lot of questions as to where that good health care is many times.
You wanted to give the vets real choice, put them in the driver's seat so they can make their own appointments and stay with a civilian doctor who can help them. Give those older vets a Medigap card. That's the way to do it, and it will cost half of what this bill costs.
I've got about a minute left here. I need to get your opinion on this as well. The share of Americans with an unfavorable view of the Affordable Care Act is up again. We have a graphic here and some numbers to show people now. Unfavorable in June was 45%. July, it's now 53% of Americans here. And it also seems that most Americans still believe that new enrollees had a choice of private plans. There's still all kinds of confusion 4 years after this law's passage as to what it really does.
One of the reasons that so many Americans are against this law is that they see their own jobs at risk. Look at the June job numbers. More part-time jobs created, more full-time jobs lost. This law is a job killer because of the looming presence of the employer mandate. And in order to get people back on the job, full-time jobs, we've got to repeal this law.
Now, repeal the law, because it does say that most Americans still want Congress to improve, though, not repeal the law.
Unfortunately, the truth is that this law is rotten to the core. You've got to repeal it to get rid of the special bailouts for insurance companies. You have to repeal it to get rid of the special deal for members of Congress who are getting subsidized plans even though they earn a base pay of $174,000 a year. This bill is corrupt to the core. Repeal it and replace it with something that will honestly help people who need health insurance.
Betsy McCaughey, a Newsmax insider and somebody who knows from where she speaks. We thank you so much for taking the time, Betsy. Let's do it again real soon.
Look forward to it.
Thank you very much. All right, still coming up on the dance card this hour, the young and dynamic option for America's political future. And after the break, calling those who pay your salary a band of nut jobs and not being questioned about it. No, you can't get away with it, but somebody sure did. That's coming up right here on MidPoint.